Hi, beautiful people. How are ya? I hope you're having a great day.
With you, I can be sad with you. Just take my hand and fly up through the dreams where the skies are so clear.
Because there will be new research that we will want to cover that will come on the heels of that 2021 study on fibromyalgia, where they used mice and the immunoglobulin G or IgG of Fibro patients and healthy controls that led to their statement that fibro might potentially be an autoimmune disease. Wow. And that one sparked a lot of interest. And so I wanted to go back over some of the things that came up in that study and what other researchers are saying about it, or that kind of wraps around the same thing. So buckle up. We will cover IgG, antibodies, and what they tell us about fibromyalgia, and a discussion of fibro as a neuropathic pain disorder. So here we go. There are 5 main types of antibodies. We have immunoglobulin A or IgA, IgD, IgE, IgG, and IgM. Each one has a specific purpose. This is our defense system. The system will get activated when there's a threat to our health and produces antibodies against that antigen or foreign matter or allergen. And typically, antibodies are produced by white blood cells in response to infection. IgG is made by B cells and takes a while to be produced because it's longer lasting and may stay in our system for years. It can neutralize toxins, antigens. It is also the only antibody that can pass through the placenta from the mother to the baby to provide protection. And of course, any type of bacteria or virus can cause IgG levels to rise or decrease. The blood test can also show whether there's a problem with your immune system and if antibodies are fighting off bacteria, viruses, or other harmful invaders. When IgG antibodies go wrong, they can also trigger autoimmune attacks on human tissue. If IgG is increased, it's associated with liver disease, autoimmune disease, vasculitis, infection, but there are probably other things that cause IgG to be increased, like medications. 2021 study on mice, which led to the theory that fibro might be an autoimmune disease. The authors believe that the autoimmune attack isn't targeting just any tissue. They suggest that an autoimmune attack has targeted the actual nerves in fibromyalgia. Wow, autoimmune attack targets actual nerves. That kind of makes sense, right? Mice were injected with purified IgG from people with fibromyalgia and also healthy individuals. Within 2 days, the mice given the IgG from the fibro patients had become hypersensitive, meaning they had a huge immune response in terms of pressure, cold, and pain. They also had reduced grip strength. The mice given healthy IgG showed no symptoms. So the IgG in the blood of patients with fibro certainly made an impact on the health of mice. What's really interesting is that the IgG from fibro patients never made it to the spinal cord or the brain, as suggested by the theory of central sensitization. IgG mostly accumulated in the glial cells surrounding the dorsal root ganglia. So these glial cells outside the spinal cord were very active, but the glial cells inside the spinal cord were working normally. Just think about our peripheral problems like hyperactive sensory nerves, disappearing small nerve fibers, and some immune issues. And there is a high rate of fibro found in autoimmune disorders, even though there is a lack of consistent and clear inflammatory findings in fibromyalgia and ME/CFS. Researchers have searched for evidence of inflammation for years. This is when, in 2016, Goebel wrote an article suggesting that, quote, where autoantibody binding to nociceptors can directly cause pain without inflammation, unquote. That's big. Nociceptors can cause pain without inflammation. And internal organs. They respond to tissue damage or stimuli and are usually accompanied by inflammation. So this is fascinating and would explain why fibro patients don't have the normal inflammatory markers if there isn't an overlapping inflammatory condition. This would certainly explain why those cytokines that are often associated with pain and fatigue have not been found consistently in fibromyalgia and ME/CFS. But in this study, at no time did systemic cytokines increase, which would explain this problem. Oh, I think we're finally getting somewhere. Is it possible? Because the concept of autoantibody mediated pain offers hope for the development of innovative therapies for current intractable pain syndromes. Intractable pain is a permanent, severe pain condition, mostly unaffected by drug administration, like fibromyalgia. Prior to the 2021 study on fibromyalgia, in 2019, Goebel's team did a study on CRPS, complex regional pain syndrome, where he developed an IgG transfer trauma model with mice who showed CRPS symptoms. So IgG can cause all kinds of havoc on the body when it gets out of control. So in 2016, let's go back, Goebel, as stated previously, suggested autoantibodies were causing pain without inflammation. So what's going on? It appears that our glial cells wrap themselves around our dorsal root ganglia found outside the spinal cord, apparently to protect them. It's believed that the dorsal root ganglia may be the fibromyalgia neural hub, where different stressors can be transformed into neuropathic pain. while the glial cells surrounding the dorsal root ganglia outside the spinal cord became hyperactive, the activity of glial cells inside the spinal cord remained the same or normal. So a chronic pain state is born without the activity of the central nervous system involvement. This is all quite different from the central sensitivity syndrome we are told that fibro is, and the new term of nosoplastic pain to explain central sensitization. On top of that, at no time, as I stated, did systemic cytokine levels increase in the 2021 mice study. So whatever is happening with IgG, it is doing it very locally. In Martinez-Lavin's concept, he's a researcher, fibromyalgia can be conceptualized as a neuropathic pain syndrome and dorsal root ganglia as the primary pain source, not the brain. Martinez-Lavin says there is no need to propose nosoplastic pain as the new chronic pain mechanism. Remember that? I did a video on the new classification. I'll link it below in the description section, and hopefully it'll show up properly here. In that video, I explained the difference between nociceptive, neuropathic, and nosoplastic pain. So not all researchers are on board with that new classification, but when there's a clash between researchers, it causes them to work harder to prove their point. And that's what we need to get to the bottom of all of this. According to researchers, there are those three types of pain: nosoplastic, the new one, nociceptive, and neuropathic pain. According to Martinez-Lavin, the nosoplastic pain paradigm disregards cumulative evidence suggesting fibro as stress-induced neuropathic pain syndrome, including small fiber neuropathy pathology in fibro. And as a side note, Martinez-Lavin has been calling fibro a neuropathic pain syndrome since at least 2006. And he says that neuropathic pain excitability is put into play at the dorsal root ganglia. So, neuropathic pain can be linked to diseases like MS, multiple myeloma, and other types of cancer. But not everyone with these conditions will experience neuropathic pain. Diabetes is responsible for 30% of neuropathic pain cases. Trigeminal neuralgia is a painful condition with severe neuropathic pain and can occur without a known reason. Herniated disc and spinal cord compression can damage the nerve fibers around the spine and can cause neuropathic pain. Although infections rarely cause neuropathic pain, it's known that shingles can trigger neuropathic pain along a nerve, and post-herpetic neuralgia is a rare complication of shingles that involves persistent neuropathic pain. But other causes of neuropathic pain include vitamin B deficiency, carpal tunnel syndrome, thyroid problems, facial nerve problems, and arthritis in the spine. So maybe fibromyalgia really is a neuropathic pain syndrome. Neuropathic pain is often described as shooting or burning pain. It can go away on its own, but is often chronic. Sometimes it's unrelenting and severe, and sometimes it comes and goes. It's often the result of nerve damage or a malfunctioning nervous system. Is that what is going on in fibro? There's definitely not a consensus on this topic, but symptoms are shooting, burning, tingling, numbness or loss of sensation, spontaneous pain or pain that occurs without a trigger, evoked pain or pain that's caused by events that are typically not painful, such as rubbing against something, being in cold temperatures, or brushing your hair. A chronic sensation of feeling unpleasant or abnormal, difficulty sleeping or resting, and emotional problems as a result of chronic pain, loss of sleep, and difficulty expressing how you're feeling. This sounds like me, but there's also the constant all over body-wide muscle pain that is also felt in our joints as part of our fibromyalgia. The cause of neuropathic pain, well, usually a chronic progressive nerve disease is the cause of neuropathic pain, but it can occur as a result of injury or infection. We certainly learned that although fibro is not considered a progressive disease in the eyes or minds of doctors, it certainly feels progressive to many of us. So maybe this explains it. If you have chronic neuropathic pain, it can flare up at any time without an obvious pain-inducing event or factor. Persistent pain can occur long after an accident. When an injury heals, the nervous system may not. We can compare this to nociceptive pain that is caused by an event or injury, like dropping a book on your foot and feeling that pain. Tissues of the foot might be damaged. The body sends pain signals to the brain immediately. Nociceptive pain usually heals after the inflammation is cured. But in neuropathic pain, there is nerve damage. The pain tends to get worse over time. So understanding the possible causes of pain can help prevent the pain from getting worse over time. In the case of fibromyalgia, we know that stress is our worst enemy. Fibro is clearly a stress-related disorder. It's not something that I can say easily because too often people run with that as if fibromyalgia is all in our heads. But there are psychological, physical, metabolic, infectious, or autoimmune stressors that are frequent drivers of fibromyalgia. Many autoimmune diseases are linked to stress. But in fibromyalgia, is it the accumulation of IgG in the glial cells surrounding the dorsal root ganglia outside of the spinal cord causing all of these issues? More research will provide these answers, but that is what is believed. With all of this research I have mentioned, it is possible that fibro is a, quote, localized autoimmune illness, unquote. That was from Dr. Martinez-Lavin in 2021. But he says that more research is needed. I happen to think fibro is potentially a new kind of autoimmune illness. But, we're in a time when fibro is getting the attention it deserves, and well-structured scientific evidence is underpinning innovative research. So we'll know so much more in 5 years, maybe sooner, and it's so exciting. In 2013, Goebel proposed that chronic regional pain syndrome, or CRPS, is a new kind of autoimmunity. And those other disorders like fibro, ME/CFS, IBS, interstitial cystitis, and chronic pelvic pain syndrome may be autoimmune as well. In 2017, researchers Schoenfeld and his team proposed ME/CFS, POTS, and CRPS belong to a new category of autoimmune diseases they called autoimmune neurosensory dysautonomias. That's an interesting one. And I think I'm going to have to do a video just on that alone. So is there damage to those glial cells where the IgG is accumulating, or is there actual damage to nerve cells throughout the body that is not detected yet? I know that about half of us have small fiber neuropathy, but what about the other half? I hope this made sense to you, and I hope you learned something. I did. I send you gentle hugs and support. Love you.